Welcome, everyone. I'm super excited to be here today with a dear colleague, Dr. McCarthy, who is an expert in the world of gun violence prevention and unfortunately takes care of patients who have suffered from gun violence. So I'd like to welcome my esteemed colleague, Dr. McCarthy. Dr. McCarthy, could you start off by introducing yourself and telling us a little bit about your career?
Thanks very much. Yes. So, Jamie McCarthy, I'm an emergency physician by training. I've worked in the Memorial Hermann Health System since 2001 as faculty at the University of Texas in the Department of Emergency Medicine, and chair of that department for my last couple of years there till 2017. And in 2018, I transitioned to take the role as the chief physician executive in the Memorial Hermann Health System. This is a large nonprofit health system in Southeast Texas. We're Houston-based, and in the Texas Medical Center campus, our level 1 trauma center, where we partnered actually with the University of Texas and their team, where I've worked for the last 20 plus years.
You know, I'm a fellow Houstonian, not born and raised, but love the city of Houston. I know you're doing amazing work there, and unfortunately, probably see a lot of difficult cases. So, you know, as you mentioned, you're at Memorial Hermann and you oversee the Red Duke Trauma Institute, which is actually one of the busiest level 1 trauma centers in the country. So I was wondering if you could tell our audience a little bit about the types of cases you get and what a level 1 trauma really means.
Yeah, so I've been fortunate to work in some ways the busiest level 1 trauma center, one of the busiest in the country. It's a incredibly exciting place to be a clinician, in that we never know quite what's going to come in the door. And I often tell people I have the rare privilege of being with patients on what's often their worst day, maybe not their worst day ever, but often their worst. And unfortunately, with trauma, we do see people many times on their worst day. And we see everything. We're an adult and children's level 1 trauma center. So we see small children injured in accidents at home. We see adults, elderly who've fallen down. And then, of course, all of our high-speed accidents that we have, automobile accidents, jet skis, boats, ATVs, you name it, we see them all come through. And unfortunately, especially over the last several years, we've seen a rise in interpersonal violence and a rise in violent events that results in patients assaulted, shot with firearms, stabbed. We see the whole spectrum, and they all come rolling in.
Yeah, I know from my previous ER days in training, it's a pretty stressful place to be. And you know, from a pediatric perspective, you know, the population that you are probably seeing on the rise is firearm related injuries and deaths in kids. And now it's the leading cause of death in kids and teens, which obviously makes me very sad as a parent and as a pediatrician. You know, how are you seeing that reflected in your ER?
Yeah, so sadly, we've seen a steady increase over the last 3 years in firearm injuries to people under the age of 18 and less. If you go back to between 2019, we saw about 200 in this age group in 2019. In 2020, during that fun, exciting year we jumped to 267. So that's a 31% increase. That number stayed steady through 2021. And then in 2022, we had another 6% increase up to 280 odd children injured with firearms, or people 18 and under injured with firearms in our emergency department alone. We know this has been a kind of a epidemic of violence that's happening throughout the country. My colleagues in Chicago tell me a similar story. I trained in Chicago and still have lots of colleagues there. They're seeing similar events there. And we know from national reports and from the CDC, it's rising everywhere. And in Texas, we're no different than anywhere else, sadly.
Yeah, I know the numbers are rising everywhere. And you know, I'm curious, as you've seen the numbers increase in kids or adults, from a medical perspective, how have you seen the landscape, so to speak, of gun violence in the patients that you're seeing? What's different today than when you treated patients 10 to 20 years ago?
One, unfortunately, the main difference seeing here in Houston is the significant rise. And that rise I talked about is just in the last 3 years, but it's risen significantly in our city over time with population growth and with more access to firearms and concerns about how they're handled. I mean, in Houston alone, we've had, I believe, 3 now children under the age of 8 killed by another child under the age of 8 with a handgun in the home just in this calendar year. And There may be another one I've missed, but I know of at least three. That's a growing event that we see. We've also seen, I think, increasing number of higher caliber weapon injuries. Now, fortunately, we don't see a lot of high caliber injuries is in part of normally most of the gun injuries we see are handguns. But certainly with hunting injuries and accidents, we can see high caliber weapons often discharged at close range, and those are often devastating.
I'm curious to learn more about the impact that you're seeing in terms of, what types of injuries and, what does the recovery look like for those that do survive the types of injuries that you're seeing?
Yeah, so I think that's a really important point. One of the things we often talk about with firearms and firearm safety is the death rate. And it's important to acknowledge that a large number of firearm deaths are suicides in the United States. That is a mental health problem that also needs addressing. But we don't often talk a lot about the carnage that happens from a gunshot wound to someone who does survive. And we see everything from people who, fortunately, some people get very lucky and have a grazing injury, and they can recover from that, and that's the end. But for many people, it's a lifelong trauma that will happen after they've been shot. And you can imagine an injury that goes through the chest that permanently reduces your lung capacity, causes injuries there. You imagine I've certainly seen a number of people paralyzed after a gunshot wound where they will never walk again. Everything from quadriplegic as well from gunshot wounds. A gunshot to the joint can have a devastating impact and lifelong impacts on mobility, and sometimes with large soft tissue losses, even resulting in amputations after gunshot wounds. So there's really a huge spectrum of morbidity that follows many of these patients. Many of those shot through the abdomen will end up with a colostomy, at least temporarily, while they heal with that, and the challenges of learning to live with that new apparatus until hopefully can be reversed at some point, but not always. And then, of course, the injuries that involve the head, right? Permanent neurologic disability, injuries to the face with permanent cosmetic disfigurement that make it more challenging to go about your daily life. Never mind with the mouth, injuries into the neck with vasculature that can result in a stroke. So even though the gunshot didn't go through your brain, the resulting impact results in permanent neurologic injury. So I could go on and on, but it's, I think, a very under discussed topic is the morbidity from the injuries as well.
Yeah, no, I think you're absolutely right. I don't think we talk a lot about what the impact is on those that survive a gunshot wound or a firearm injury, and they can be really devastating and life-changing. I also think that, related to the injuries, we're not hearing as much about the differences between, as you described, handgun injuries and or deaths and an assault weapon like an AR-15. And you're probably familiar with the Washington Post. They recently published on this about the blast effect of AR-15s. Again, as a neonatologist, I'm thankful I don't have to see these, but in my training days, I did see injuries from guns, unfortunately, too often in kids. But we didn't have as many AR-15s around. So I'm just, I think it's important for folks to understand the difference between those two types of injuries and what we should be thinking about when we talk about the different types of firearms.
Yeah, so I think that's a very good point. And there's one, again, most of the injuries we see, fortunately, are lower caliber have less sort of the cavitation, and that Post article documented so well with how large an injury comes from such a relatively small bullet. And it's really about velocity. That's really the driver on it. So the higher velocity weapons, so hunting rifles, not shotguns typically, but hunting rifles, and then things like AR-15s do cause a much larger injury at close range. And one of the things when you look at some of the mass shootings we've seen throughout the United States, it's often a very high fatality rate with those when those are done with large, high caliber weapons. The one notable example would be Las Vegas, where there was a very high injury rate and a lower overall mortality rate compared to things like the Pulse nightclub and some of the others. And that has to do largely with how far away that gunman was. Those bullets had lost tremendous amount of velocity, so it didn't result in the same massive tissue injury that resulted in unfortunately, a relatively rapid death in many of these other cases. So the higher caliber of the weapon, the injury can be much, much more devastating, especially at relatively close range.
Yeah, and that's why I guess you know when you see the injuries from those types of assault weapons, you know, the injury that it caused internally makes it not even, there's not a chance of survival typically, right? Because it expands as such, and the blood loss is so quick and acute.
Yes, the soft tissue injury is so much larger with a high caliber weapon, high velocity weapon, that it's much more likely to be life ending with a single shot.
So, you know, I'm a big fan of Texas, but the deaths of firearms are rising in Texas, just like everywhere else. I mean, I'm from Florida, they're rising there. They're kind of seemingly on the rise everywhere. And in fact, the gun homicide rate in the US is 26 times higher than that in other countries that are equally developed. And research does link, right, common sense, public safety laws, you know, to reductions in gun violence, and obviously it's lives saved. So, you know, I'm just curious, you know, as a physician, you know, it worries me that things are continuing to loosen, and I'm curious, you know, what are your thoughts on the future, knowing this data? Where can we go next as healthcare providers to help with the epidemic, knowing that, you know, we're seeing the rise in injuries and deaths, and we also are seeing the gun safety or common sense laws, you know, getting more loosened?
Yeah, so I think there are a couple points, and some of it is where, and I recognize a very, very complicated political issue with a lot of very passionate voices and multiple sides, but they're clearly things that we can all agree on. And I think we would all agree that children shouldn't shoot other children or be able to shoot other children with poorly stored firearms, and that firearm safety is one of the things that Memorial Hermann has taken a strong position on. We've passed out over 10,000 gun safety kits in our community with plans to continue that, and really hoping to, as medical professionals, educate parents, young parents, about the threat of guns in the house, you know, the threat of not just a small child accidentally finding it, but the danger to an adolescent going through a mental health crisis and having access to a firearm dramatically increases the risk for suicide for that individual. Will it not all prevent it? No, but educating the public about the need to take care of your family by properly taking care of the firearm in your house. Then say you can't have it. Let's just figure out how to keep it safe and keep your family safe from something you want and have the right to own and enjoy. We also, though, are taking other steps. We're hardening some of our entrances to our facilities and hospitals to protect people, recognizing that our nurses feel less secure than they used to. So weapons detection system being deployed in some of our facilities to help. And I think that is sadly going to increase as we hear about increased workplace violence. And I'll tell you, one of the number one concerns for our nurses working is workplace safety. Recognizing the proliferation and access to guns makes people sometimes more uncomfortable in that space. So how we can provide a safe working environment for our employees and personnel and make sure that they feel comfortable at work is another key part of what we're needing to do. And I think that's going to be more broad spread than just us.
Yeah, you know, I mean, I, as you know, I mentioned I lived in Texas and Houston for over 10 years. And, you know, when I moved there, it was pretty commonplace that a lot of folks have guns, and that's okay. You know, we know that there's a lot of responsible gun owners. And I felt like the folks in Texas that I met who you know, talked about their guns and having guns, they were so responsible. They kept them locked, secured, you know. I didn't worry. And in fact, if you look at, you know, even the NRA members support comprehensive background checks and other sort of common sense gun laws, because that can help us to be more safe, but still for those that want to have a gun can have a gun. It just seems like something we should all be able to agree on. Why do you think it's so hard to come together when it comes to common sense gun safety laws?
Oh, I wish I had the answer to that.
I know. I'm just curious.
I come back to education. I think it is about educating people, the public, who are concerned about their right to have weapons. That they're concerned. How do we protect protect their right while protecting ourselves at the same time. And I think that's a nuanced conversation. And I think part of why we struggle is we haven't had enough nuanced conversations, right? The largest drive for gun death prevention related to mental health is in suicide prevention. And we need to be open and talk about that. The mass shootings are obviously horrific and disaster. They're much less of a real factor for us in the United States than is the suicides that happen with gun every year. We need to address that and address that openly and honestly and not dismiss that from either side. We also need to be much more serious about, I believe, the education that we make available for anyone who comes across the gun. One of the important ones that's often not done also, there are folks who don't have guns and don't think they need to teach their children about gun safety. And you absolutely do, because you don't know whose house they're playing at, what's in the cabinet, what's in the garage. So making sure your children are educated about gun safety, even if you don't own them, is a critical thing to continue to be part of our dialogue. And I think if we can increasingly have a dialogue that bridges the divide, that everyone agrees, yes, everyone agrees we should figure out how to keep guns out of people with mental health challenges, even our own children. We should talk about that. We should also talk about how we keep all kids safe from guns for accidental shootings in the house, right? What are the questions that we need to teach people to ask? Those are things we all agree on, right? And, overwhelmingly, lots of people agree on background checks. I know, again, a political issue, but I think addressing what we're trying to do, which is keep guns out of the hands of people that are going to do evil or harm with them, is a common goal. We just need to talk more about the nuances to get to real solutions.
Yeah, I mean, they say the leading risk factor for death by a firearm, whether it's suicide, homicide, accidental, is access, right? And so I think if we can all come together with, common sense laws, then we can limit the access to individuals that, are not, appropriately equipped, educated, able to safely have access to those guns. Protecting our kids, like you said, is tremendously important. And, something that I've constantly had the conversation with my own kids is, when they go to a friend's house, I remind them, if they get shown a gun, what they need to do. And that's get out of the room as quickly as possible. Assume all guns are loaded and lethal. And these are things that parents don't want to have. Or I call the friends' parents and I say, do you have any guns in your home? It's important to have that conversation. I don't know why guns are a tough topic of conversation, but it really can save lives.
Well, I think part of it's because people drift to the extreme very quickly, and we don't have that nuanced conversation. I love your point you made about access to a gun. It dramatically increases your likelihood of being injured or killed by one. And I'll go to an analogy I've used before that it's the same with cars. Your likelihood of dying in a car accident goes up dramatically based on your access to a car. The more you drive, the more access you have, you are accepting some level of risk. But we all do things to make that risk less, right? We make sure we have good tires, we wear a seatbelt, we have all kinds of new safety equipment that has been put in place to make what we want to continue to do safer for us to do. Now, I'm not going to get into what should we do with licenses and training and all that, but there are really practical things that we did. Many of them dramatically opposed by auto manufacturers, the lay public, until we all kind of said, it's going to be better for everybody if you don't die when you crash your car. So we're going to require airbags. We're going to require seat belts. We're going to require braking systems. All those things were put in. We're going to require crashing bumper testing, right? And increasingly now we're going to require that your car is safer when you hit another person who's walking. All of those things we put in to make something Americans love their cars, want to continue to drive. Got it. Let's figure out how to do them safer. And we've done that as a collective. So again, I'm back to if the only response when people were dying in car accidents was, that's it, everyone's going back to horses, we're not going to have these anymore, it's not practical. And I think the same thing with guns. If we don't talk about the extreme that we're going to take them all away, lock them all up, let's agree that's not likely to happen. So let's talk about the things that we could do that would start to make an impact. And the more people that are on board with that, the more successful we'll be.
Yeah, I think you bring up a really good point, and it's getting to solutions. We're in a situation where there are many guns in our country. but access is too easy, and that's causing us to disproportionately have such a high rate of death and injury. And in some states like Florida and Texas, I mean, a gun death happens every 2 to 3 hours, which is crazy to me. As a physician, it pains my heart, and then I worry about my kids' safety, and so as a parent. So I'm curious, I like the car analogy. Like, are there any specific solutions to the gun violence crisis that you think we should all be aware of or be thinking about?
So I'm going to come back to tactical, like practical ones that I think are related. And again, a group I'm particularly passionate about children, right? And I mean adolescents. I mean the suicide risk there too. That the practical solutions in the home is that no firearm is left unsecured. So those are with trigger locks or in a locked safe. The ideal solution, of course, is ammunition not stored with the weapon as well, because you all know kids get into all kinds of stuff and they'll figure out the combination or do that. Or importantly, also recognizing mental health changes within your family and when the need to change your personal security with firearms may change. So if you have an adolescent in the house who is struggling with even slightly with depression, with bullying at school, with substance abuse, just behavioral issues, a good time to think about getting guns out of the house for the short term until we're sure that mental health crisis isn't evolving and developing. Most parents don't think that their children are suicidal or going to do something like that. So you have to be aware that you've got something in the house that increased the risk for your children, and thinking about when you can get those out of the house, even if it's for a temporary period. But again, I think practically educating families on how to protect their families from things that they have in their house is critical for us, and critical for us as healthcare providers. That is something that we need to be doing.
I think you're absolutely right. And I think the mental health crisis right now that we're dealing with is very challenging. And like you said, it's access, right? So it provides you the opportunity to take an impulse that maybe if you had some time to think about it, maybe you wouldn't, having access to a gun so easily. So I'm curious about, I'd love to talk a little bit about the mental health crisis, the state of mental health in our country and the state of our gun violence crisis. What are some common truths and misconceptions about how the two are related?
So one common truth is around mental health is it's underfunded, undersupported throughout the United States. The access to mental health resources, particularly for those people on lower on the socioeconomic scale, are incredibly limited. Texas is certainly one of those. We don't have nearly enough inpatient psychiatric facilities or access to outpatient psychiatric facilities. We have mental health patients boarding in every emergency department in the city of Houston on any given day, waiting for a bed somewhere.
Even in kids,
yes, even
pediatric
in kids.
ERs are
exactly.
overwhelmed. Yeah.
So we need more access to that, and that's going to require public support. The reimbursement in mental health is inadequate to attract lots of people to the field, sadly, or to build out large services. So we need that kind of support. I think there's another misnomer, though, about the vast number of firearm shootings that happen in the United States are not caused by people that would say they have a mental health problem. So this is not people who are very decompensated with a mental health crisis. Some of them certainly are, but many of these folks are, we would say, disturbed, right? That they're choosing to use a firearm against other people, whether it's for anger or violence, road rage incidents, or a robbery or shooting. That I think those of us who think that's unconscionable, couldn't think of it, think, well, yeah, there's a mental health problem. But all of the work we do talking about needing to address mental health doesn't address all of that. There is still a challenge with firearms being used by people who seek to do harm that are not going to be fixed by all the money in the world taking care of mental health problems.
Yeah, I think you're absolutely right. Any ideas on how we solve that piece?
Well, so that's a much more complicated challenge that I'm not sure as a physician I've got the best answers for it, but that's us figuring out how keeping the guns out of the people who shouldn't have them and what that is. And I think everyone I think everyone agrees that's a good idea, that there are people that shouldn't have guns and we should be able to figure that out. There's a whole lot of disagreement on how do we figure that out and who gets to decide. So that's going to be a much more nuanced answer that I'm not sure I have the most, I'm not sure I'm the right person to give you that answer, but it certainly involves, certainly in my mind, it certainly involves things like background checks and understanding when you've got someone who has demonstrated a propensity to violence. How do we address that? And I don't have the answer for it, but I think we need to start talking about it. Talk about, what happens or what kinds of things result in activities that would make us concerned about you having access to guns. But I wish I had an answer for it. I'd probably then put it out there and run for office and get elected, and we'd fix all the problems. But I don't know if that'll happen.
I know it's never that easy, right? Especially with these big issues that we know are impacting safety.
Yeah. So one really, I think, positive thing that is happening now that it gives me hope that we will start to get answers is there is now, after some important changes in DC, the ability to more accurately do research around firearms and firearm injuries. So understanding better through research, through forensic research, with law enforcement, with the CDC, with academic institutions, understanding what is a common theme in shootings and gunshot wounds, where do the guns, I don't know, where do the guns come from? Are they coming from people who had the right to buy them licensed? Are they being stolen? Where are the guns that are used for bad intent? Where do they come from? Where do those people get access to them? And how do we think about tackling that problem as a society? So I'm optimistic that research will help give us some answers that we've really been sort of blind about up till now.
I think you're right. The research piece is huge, and we hadn't been able to do much research previously. And the fact that now laws are opening up to allow us to understand it. I mean, as physicians and physician scientists, we know that unless you really study the problem, you can't necessarily diagnose what the causes are and then identify the proper treatment plan. And, this is a public health crisis like any other. And so we need to figure out what are the causal factors, what are the preventative measures that we can institute to make sense and go on from there. I think we've been researching how to treat individuals with violence, right. Injuries, but we haven't really figured out how to prevent the injuries.
Agreed. And I think, we have, back when I was training in Chicago, we used to see occasionally military talking to the medical professionals in Chicago about how to treat gunshot wounds because they hadn't seen the same numbers. It's clearly now the other with all of our years in theater now, the Army, all the armed forces have now brought a lot of the learnings of combat casualty management back into the civilian space. So we have very important programs like Stop the Bleed now throughout the community, programs that we help promote and direct with having access to tourniquets, access to pressure packages out in the community to help treat people, which is great. But prevention is obviously where we need to get, right? And lots of great efforts around awareness that folks are doing, things like the gun safety kits that we put out, but we need more in prevention. And hopefully research will give us some of the keys to understand where the ripe targets are to address next.
And I think, for the things as we do learn that are preventative, I hope that we can come together to back those up and help save lives. Given where we're at now and, the fact that we're still trying to understand the problem, but we're definitely in the middle of a crisis. What do you think things are going to look like in 5 to 10 years based on your experience thus far?
Yeah. So I'm a funny sort of view of the world, right? I have to be a pessimist because I'm an emergency physician, which means I'm always convinced that the sky is falling. But for most of society, I tend to be an optimist. So I do believe that we as a community won't tolerate a continued rise in injury and death, and that we are likely to start take effects. And I don't know where they start and which way. Obviously, there are going to be different solutions in different states as we learn. But I do think we will start to tackle how do we keep guns out of the hands of people that shouldn't have them. I think that's coming. I just think the collective tolerance for it will have to go. And I think there's reason to be optimistic about that. If you look at large groups that are often cast in a disparaging light in this space. The NRA is very interested in gun safety. Now, we can talk about some of the policies that are backed, and does that really back gun safety? But if we engage large groups on both sides of the political aisle on this related to safety, I think we can make an impact. And I think it's becoming so prevalent and so obvious to the world what's happening here that I think there is a growing interest in doing that collectively. There will be people that fight everything we do and people that say whatever we do isn't enough, but I think we are going to start making progress there. I just don't see it growing and continuing to worsen for the long term. It may get a little worse before we get any traction, but I think we're going to have to, we will collectively start to make that. Parents are not going to want to have their kids doing safety drills in schools. We're not going to keep hearing about an 8-year-old who shot their 6-year-old little sister on the news. Those things increasingly demand a public solution.
You said it. I mean, as a parent, I worry about my kids every day, and I know that the mass shootings, the school shootings, while they're not a high percentage of the deaths that happen, the number of them are just going up and up and up, and it's a scary statistic when you're a parent. And but we also know that we have to help the access for individuals who might be at risk for suicide, and you never know who may be contemplating that or may make a rash decision. So yeah, I'm glad that you're optimistic. That helps me to remain a little optimistic as well. It's really important that I think as physicians who see all the bad, the worst of the worst, to remain optimistic. Again, for you, working in the ER and a trauma ER for your career thus far for 20 plus years, and seeing the epidemic of gun violence getting worse, how do you personally stay resilient during these times?
That's a great question. I will say that I'm blessed to have a wonderful family, my wife and 2 daughters that are tremendously supportive. I think it's also critical that the healthcare professionals take care of yourself. We have a program within our Memorial Hermann system, piloted up at Hopkins, I believe, issuing the Code Lilac program, where we offer real-time support for someone who's had an emotionally challenging event in the hospital or had one at home, but is at work now. So we offer that support internally. I think it's super important to be able to decompress and talk to your colleagues you're going through. Not one strategy used in some places, a moment of silence when someone passes in the emergency department during an event. But for me, it's about being able to get out of it, to be with my family that I love, and do the things that I enjoy outside of work that energizes me and gets me back to it.
Yeah, I think one of the things that I'm feeling and seeing in all of my colleagues up here in Boston is just this the burnout and the challenge of staying resilient, especially as we kind of, I think, traverse one epidemic after the next, right? We've gone from COVID to now firearm violence and then mental health, crises. So it just seems like it's one very large challenge after the next as a field and as a group of people trying to save lives and make the lives of others better. So thank you for reminding us how to stay resilient, and sounds like you're doing some great things in your system to try and help your healthcare providers and clinicians stay resilient.
Well, we think, it's clearly a critical point, and an emergency medicine is known to have a high burnout rate in my specialty. And I think, if you think of all the stresses that come with doing high acuity medicine, or just, I shouldn't say just high acuity medicine, with medicine in general, the stress of taking care of other people. And unfortunately in healthcare now, the increasingly incidence of non-clinical tasks put on the clinician. So the burdens of documentation that our nurses have to do now, their physicians have to do now, all of those things have just compounded and made it harder to do what we all signed up to do, which was just to be there to take care of the patients. I know there are people that love the EMR, but I miss the paper charts. They were easy, they were fast, everybody got it together. But the workplace, things we do in the workplace related to workplace safety, looking to reduce administrative burdens, all of those are to help our staff be more resilient, so that they can help continue to provide the outstanding care they do to the sick and injured in the greater Houston area. And Yeah, so lots to do still in that space. Some of that ties right back again, as I said, to firearms, to making them feel safe at work, that they're protected by what could come in the door.
Well, we're in the middle of the crisis still, and hopefully we can get to some solutions really soon.
That
Thank
would
you.
be great for all of us. Great.
Yes. Yes.